So I wanted to welcome again Dr. Lindsay, who is going to share with us about Life Care Humboldt. And I didn't get your bio, so I can't tell people the wonderful things that you have done, but Anne has done a lot of wonderful things. She was worked for public health for many years, supporting our public health in our community, and as medical director. She's also worked with Stanford. She and her husband left the community for a while to do some great things down at Stanford. But today she's talking to us about how to make our process of aging in Humboldt much more, since everyone's doing it, much more, well, providing more options for us so that we have what we need here in Humboldt and don't have to leave the area. So Anne, I'm turning it over to you. Do you have slides you want to share?
Yes, please. I need
there you go.
To share the screen.
Yep.
Okay. Here we go. I'm first of all, Maggie, thank you for sharing the vision of Rotary. I wasn't aware. And then I also noticed that you have a lot of young people here, so be patient. This is, you maybe have parents or other people you know who need elder services. But I'm going to be talking about Life Care Humboldt. As Maggie said, I was health officer for 28 years here, and then my husband, Alan Glasseroff, and I got an opportunity to go to Stanford and set up a clinic for people high risk and high needs, and that was a great experience. But when my contract came up for renewal, I really wanted to get back to Humboldt, and I don't want to leave Humboldt again. So, and I had a number of friends who left the area to go to life plan communities, senior life plan communities, and the closest is Santa Rosa or Medford. And I met a lot of people who really thought we could do something here, and actually we did a initial feasibility study, and it said Humboldt could support it. But the context is, and for those of you, not only the older people in the audience, that according to the Humboldt housing plan, that the growing population of elders may be the #1 housing challenge facing the county in coming years. And that actually the number of people 75 years and older is growing steadily for the next 25 years at least. And then the other context is that the county needs to build 3,390 housing units, not unites, in the next 8 years. And they've only given permits for 492 total over the last 5 years. So there's, in my work here as a family practitioner over 28 years, I had a lot, as my patients got older as I did, and I had a number of patients, and especially older women, were living alone in 2 or 3 bedroom homes and actually really kind of lonely. So let's see, how do I make the next slide go? Okay, so I'm talking about life plan communities, and it basically offers seniors a continuum of living situations for all in one location. And as I said, the study showed that we could build and support a nonprofit, inclusive life plan community here, focused on active, mindful, engaged aging in Humboldt County. And it's a social investment that we need to make. And we're aiming to build 150 independent living residences, so cottages or small homes or apartments or studios, 36 assisted living places, and 36 memory or advanced care nursing places. And this is even, the study took into consideration the existing independent living, assisted living, and memory unit, but there's no place yet that has this all integrated in one facility in a nonprofit environment. And I just want to say a quick word about the memory units that we're planning. They're called small house or greenhouse. And it's basically not a medical facility looking at, it's just a big home with 10 bedrooms, and each resident will have their own bathroom and bedroom, and then a common living area and kitchen. And there's a small number of staff who really get to know the people well, and everybody eats together, and the residents are able to participate in the activities and, help with the cooking or the repairs or the gardening around there, whatever they're willing to do. So we really like that model. So as I said, the alternatives now for this type of community, you have to move out of the area. And Maggie Banducci surveyed asked a number of people to send in and what it costs them to live currently. And actually there's a financial calculator on our website, Humboldt, lifecarehumboldt.org, that you can do this for yourself. But as you can see, for a single person, the monthly expenses range from $1,525, which I think is a really good deal if you have a rent with no utility bills, all the way up to $3,800 for a homeowner with a mortgage, and then couple with a mortgage was $4,500. And so even then, living at home is this, but you also may need help to live at home. So one of the alternatives, and a number of people I've talked to said, oh, well, I'm building a mother-in-law unit, or I've got an extra, downstairs where somebody can come in and have their own kitchen and take care of me. But finding somebody you trust and get along with, and someone with the skills to care for you in your home is not that easy. And also, sometimes people leave, and right when you need them the most, and you and your family are faced with finding someone else to replace that person. I have actually heard of nice, really pleasant experiences. There are a couple of angels in our community who do this kind of work, but it's tricky. And family members may not be able to take care of you either. When I'm of that age, my children, even they live in Humboldt County, but they'll be in their 50s and still working, and the kids will be teenagers or in college, and they're not going to necessarily have time to give me the care that I need. So for home caregivers, it can cost you up to $14,000 a month, and then you also have to do, the payroll taxes and all of that, and basically be a personnel manager as well, or you or your family. So it's not a experience to jump into or plan for lightly. But alternatives are, standalone assisted living, and we have a number of nice facilities here in Humboldt County, and assisted living ranges in Humboldt from $3,000 to $6,000 a month, and skilled nursing. Your Medicare will pay for the initial couple of months if you're sent from the hospital, and after that you either pay $10,000 a month until you don't have any resources, or then you go on Medi-Cal, and about 80% of the people in skilled nursing in Humboldt are on Medi-Cal now. So let's look a little bit more at what a life plan community is. In one location, you have independent living, assisted living, and memory support, home health. And we are not planning on doing skilled nursing beds. The regulations are really stringent and expensive to do. But we are following what's going on in other life plan communities, and also in our PACE program here in Eureka. And you can do a lot to keep people at home and avoid the need for skilled nursing altogether. So it's not just for, life plan communities aren't just for people who can't take care of themselves at home. That people move into the life plan communities to live, when they're younger, to live with social connections and support. And actually, COVID has given us all a taste of what it's like to be living alone. And, once you don't have a car anymore, it really gets lonely here in Humboldt County. And one thing that we're really planning on is that activities are generated by residents. And a life plan community that I visited in 1973 in Kennett Square, Pennsylvania, there's a Quaker Kendall outfit. I just fell in love with it. It was like a college campus for seniors, and there was a string quartet playing and a poetry reading happening, and the gardens were beautiful. So I went back and visited them over a year ago, just to see if it still had the same charm, and it sure did. And one of the things that really blew me away was that a woman had moved in who was a master weaver, and she had set up a weaving studio, and they had 40 looms that people were working on. So that's the idea. We want to capitalize on the skills and interests of people who join the community, and really get everyone engaged in sharing their skills and learning new skills and expanding it. You know, the learning new things doesn't have to stop when you're a senior. And the idea is we want to make it such a fun place that people feel that life is better among friends. We don't want to be isolated off from the community. We want to make it all as easy as possible for friends and family to stay connected. But the one advantage is you don't have to worry about maintaining your home or hiring help. And I have 2.5 acres, which I love living on, and an extensively landscaped. I can't be doing that forever. You know, at some point it's really going to get too much. And that's one reason that's what's going to push me into a facility like this, a campus like this. So, but ideally you move into Life Plan community and you will not have to move again, even if you or your partners need increased care. And this, so the idea is not as much, it's aging in community. So Life Plan community, we're going to have recreation and classes, and really determined by what the residents want to do. The meals are provided, and actually look at this dining facility is Willamette View in Portland, which is just a gorgeous facility. That with the independent living, you get a meal a day, and with assisted living and memory care, of course, all of your meals are provided. And our plan is, we're planning to have a 3 or 4 acre farm, a lot like Mad River Hospital and Potawatomi do, so that we can eat right off of the right off of the produce produced on the spot. And I think that's a real viable model, and the properties we're looking for, that's a factor. Medical management, healthcare is a big issue for seniors, and we have a number of, being in healthcare myself and my husband, we have a lot of ideas for how we could take care of people's health needs, and I don't want to go into them extensively, but it's anything from having our own primary care clinic there, or all the way, to partnering with the PACE program, or at least minimally, we want to provide care coordination, where if you have to go out of the area for specialty care, like Care Humboldt, care coordinators can help make sure that you get a appointment in a timely way and with the right person out of the area, that the logistics are, we figure out the logistics of getting down there, and all your medical information that's needed for that specialty visit arrives on time. And then after the visit, all the information gets back to Humboldt County. So I think that that's a really viable model. We'll have transportation, commonly that have vans that take people to go to Center Arts, to performances, or if it's shopping or whatever. We're aiming to actually locate in there's 2 top choices. One is in Arcata, behind Copeland Lumber. There's 3 properties that could be put together that are west of Alliance and along M Street, that would make a very nice facility very close to town. And the Cypress Grove owns some land that's lying fallow there. That's a nature conservancy, which Dave Loya, the Arcata Planning, said if we had a farm there, that would be consistent. And this is all really tentative. And then the other is that McKinleyville is planning a town center, and Ann Pearson owns 47 acres, of which 15 acres are zoned for medium density housing, and this would really be a nice fit. So how does this work? Generally, the Life Plan communities charge an entry fee that can be partially refundable. So if you pay more initially, when you die or pass on, your estate gets some of the money back. But entry fees can run between $87,000 and $425,000. And for 2 people, it's not twice as much. There's a little adjustment, but not much. And it really depends on the size of the living area. We've committed to forming a mixed income community, which turns out to complicate logistics tremendously, but our board feels like that's the right thing to do here in Humboldt County. And there are various ways of figuring that out, but some of that will be in the size of the unit, but we really want to have a unified set of services regardless of what your income is coming in. And the idea is you pay a fee. Once you're in, you don't get turned out if your money goes away. That it's structured so that it's a lifetime commitment to taking care of you. There's also a monthly fee, anywhere from $2,100 to $4,100, and we're planning that the monthly fee does not increase significantly when your level of service that you need increases. So it really allows you some financial planning, for the rest of your life. It eliminates, hopefully, any of the big surprises like, oh, all of a sudden you need $14,000 worth of care in your home. So this is what you get for your monthly fee: your rent, utility, cable, internet. We're going to have tech support, which I, as a senior, I'm just thrilled about. Meals, transportation, maintaining the facility, emergency aid, fitness membership, classes, and security system. And so that's really what you can figure that's what costs you people at home, to buy all of those things separately. Here's our board of directors, and we just got Kirk Gerard. I haven't updated this. He's joined our board of directors, a former planning director of Humboldt County. Patty Berg ran the Area 1 Agency on Aging for a time and was assembly member. George Williamson of Plans West, a planner, Pat Gertze, who was the Dean of Health Sciences at College of the Redwood. Joanne Shook, who was very instrumental in getting the Redwood Coast Village, the volunteer senior organization, together. Greg Orsini, who just retired as Community Services District and manager in McKinleyville, and Mark Chatton, who's just retired also as a tech, ran the tech at Redwood, what's it called? The bank, Redwood. I'm spacing out on it now. The local bank.
Redwood Capital.
Now, Redwood Capital Bank. Yeah, thank you. The Life Care Humboldt, we're now finally, after a really long wait, we've achieved being a nonprofit tax-exempt corporation. And if you want to make a donation, you can go on to our website, lifecarehumboldt.org. Actually, donations are piling in. But one of the things I really wanted to share, and I think this is my last slide, is that we want to enable, we've adopted as core values. We want to enable residents to maintain independent lives in their own Life Care Humboldt homes. And if you want to be alone, you can, but if you want to be with people, it's a lot easier than living in your own house in the community, outside community. We want to enhance the quality of life and nurture a sense of community, promote an environment of continued learning, culture, and wellness, and fun. We realize we're going to have to make it a fun place to have people get up and take the courage to get up and leave their homes and move in. We want to welcome all people, including establishing mixed income housing. We want to provide high quality healthcare programs along a continuum of services. And we plan to adopt a model that ensures affordability and security. We want to participate in and contribute to the well-being of the larger community, engage in sustainable practices that improve our environment. And one of the people who just joined our planning group was taught sustainable building at Oregon State University in Corvallis. So that's where we're getting the experts engaged. We want to foster a rewarding work experience and professional growth opportunities for staff, because happy workers make good employees and they make really satisfied residents. We figure that there'll be up to 60 jobs created with this. We want to foster a culture of generosity. So I really would love your help in designing our own life plan community. We really want to design it with the people here. there's under you can go into lifecarehumboldt.org, and we have a design preference survey. It's under one of the tabs on the top, that general information, and it only takes you a few minutes, but then we get to know what you think, what it would take to get you to move in, and what do you think we should do. So I have about 3 minutes for questions, so I can stop sharing my screen.
Great. So are there questions or comments for Ann about this?
All right.
Well, you really gave a lot.
Howard, are you?
Ann, did I miss this? Have you found property where it will be located?
Either, we looked at a dozen places, and we need at least 15 acres, and a number of them we didn't, like the town of Scotia would have been kind of cute, but there's a big lumber mill make noise and spewing smoke. Anyway, so the two are that are on the top right now are McKinleyville Town Center, which is between Hiller and Railroad Avenue, and east of McKinleyville Avenue. There's 47 acres. And then also in Arcata, there's are 3 parcels, which we might be able to pull together behind the Copeland Lumber, between 11th Street and 17th, more or less, west of Alliance. So some of which empty and some of which have some buildings on it. The old Reed-Wright mill is one.
Rebecca, you had a question?
Yeah, I was curious the timeline, and I guess I also just wanted to say I think this is really great. My grandmother retired to a community like that in New Hampshire, and it was just amazing to see her thrive. She was a weaver. She brought her loom, so that story really resonated with me. It was really beautiful. So I'm curious just the timeline for this location here, up here.
Sure. Optimistically, 3 to 5 years. It depends on how fast we raise the money and how fast the permits and all of that go along. I also wanted to mention we had planned to have house parties where people could learn about this, but we're doing it by Zoom. And so if you're interested, and if you have some friends want to hear some more about this, you can go to the website, lifecarehumboldt.org, and let us know that, and I'll be happy to schedule house parties. But yeah, a lot of you, it won't not be relevant for you immediately, but you probably have parents or family ready to move here.
Well, Ann, we really appreciate you giving us this update on this. I think it's a great opportunity, and some of us are sitting here going, oh, that's not for me, but it's not happening right now. In 3 to 5 years, things may be different, and it creates opportunities for people to live in a home, but just home with more attributes and built and thought out with their current lifestyle and situation in mind, and to not lose out on anything in our community. So I think that's really awesome. We wanted to give in appreciation. We are donating to the Tri-County Independent Living Center here that supports people with disabilities. And we really appreciate you joining us this morning and sharing this. And thank you so much. And thank you, everybody. I came up with this. Since we had a medical doctor here, we could